They have not started.
No, sir.
Tell them to start. You call him. You play the start, no, you play that music, everything, I don't need it. Who told 225? I got 250. No, what is getting no, shut it. Can you do a 230? Yes. telemedicine room. Go on call out. How you are calling? She is in telemedicine room.
Start பண்ணுவா. Good afternoon, one and all, and welcome to this webinar in the SBV CONNEcT series. See, today we have the important topic regarding in radiology. As we know, in this modern medicine, radiology plays an important role. So today we got eminent speakers to speak about the radiology and their future techniques. We got our eminent speaker, Honorable Vice Chancellor Professor Subhash Chandra Parija sir, and Honorable Vice Chancellor Professor Ashok Kumar Mahapatra. I think everyone connected. It's over to you, sir. So, our beloved Vice Chancellor is an eminent academician, head microbiologist, researcher, keen votary of medical education, and able administrator. He also director of Jigmer Pondicherry, and he also wrote 16 books and more than 400 research papers in national and both international journals. He has been listed among top 2% of scientists globally in the field of tropical medicine, and also expert member of foodborne parasitic disease. Our Vice Chancellor got Dr. B.C. Roy National Award in the MCA in the year of 2003 for the development of medical microbiology. He also founder of the Indian Academy of Tropical Parasitology, and is also holding various fellowships that include FAMS, FICAI, FABM, and FAMC. And again, if everyone joins, sir, we can start the topic. And over to you, sir.
Thank you very much, Dr. Sivarajan. At the outset, on my behalf and on behalf of the entire fraternity of Sri Balaji Vidyapith, and on behalf of our respected Chancellor, Sri M.K. Rajgopalan, I extend a hearty welcome to my esteemed friend and colleague, Professor Ashok Kumar Mahapatra, Honorable Vice Chancellor of one of the most prestigious university, Shiksha Anusandhan University, Bhubaneswar, Odisha. I also like to extend a hearty welcome to all the participants of today's interesting webinar, a most progressive topic, that is imaging services, their importance in modern healthcare and role in health sciences universities. At the outset, I must thank immensely Professor Ashok Mahapatra, an academician par excellence, eminent clinicians and neurosurgeon, who has been supporting for all our programs, and in spite of his tremendous activities, he has spent some time with us. Again, welcome, Dr. Mahapatra. So today, what I'm going to talk is on value of imaging services in healthcare and strengthening of imaging services. That will be followed by Dr. Mahapatra's talk on imaging services and their support and augmentation in health sciences universities. This imaging service is one of the most growing services and developing services in the history of medicine. When I was student in MBBS, doing my MBBS in 1970s, I distinctly remember that time imaging services was only X-ray. And that was still being continued to use wide application. If I recollect the history of this X-ray, that was his genesis in the year 1895, when CONNEcT, a German physicist, accidentally discovered X-rays. The photograph of his spouse's hand was the first ever photograph of a human body using X-rays. The historic event took place on 22nd December 1895. Since then, more than 125 years, there is a tremendous advancement in the field of imaging. Over the years, the field of radiology had envisaged various innovations, starting from X-ray cassettes to ultrasound scanners to computer tomography, and currently the very advanced magnetic resonance imaging, functional magnetic resonance imaging, and positron emission tomography, etc. So today, what I plan to share my thoughts on these imaging services, their importance in modern healthcare, and role in health sciences universities. My plan of talk is first, I'll just emphasize what are the value of imaging services in diagnosis, prognosis, and delivering and monitoring therapy. After that, I'll give some of these imaging services which we are carrying out at University Sri Balaji Vidyapith, a University of Health Sciences. Then I'll discuss on the approaches that has been carried out throughout the country worldwide, particularly with reference to World Health Organization initiatives, and also in this 21st century with the advent of artificial intelligence, Internet of Things, robotics, etc. Just can my slide is changing. Now,
Slide is changing, sir.
yes, okay. Now, when we talk of the value of imaging services in healthcare, it's very difficult to quantify because the medical imaging over the years is a perfect example of a healthcare resources shared across all levels of healthcare delivery, all medical specialties, and to patient care at all ages. Diagnostic radiology contributes to clinical workup by refining the differential diagnosis formulated from history taking, physical examinations, laboratory tests, thereby decreasing the time required to initiate appropriate treatment, ultimately helping to reduce patient morbidity and mortality. This imaging helps not only in population-based screening programs to formulate or to assess large-scale health programs, has many wider uses. For example, common chest radiographs still being extensively used in screening of pulmonary tuberculosis, mammogram screening for breast cancer, and so on. So this technology, this facility is being used extensively over last century and has contributed immensely for the effective treatment and management of the cases. Because as we know, only diagnosis by these imaging methods saves lives, and without diagnosis, there can be no treatment and there can be no cure. And when we
think of the imaging services, starting from the age-old X-ray services. It has dramatically evolved and developed through various types of imaging services like ultrasound, further developing to other components of imaging like CT scan, MRI scan, and that is supporting minimally invasive surgery, cath lab, and so on. All have contributing immensely for the improved diagnosis and also treatment modalities in healthcare setup. And this has particularly imaging services has been contributing to disease prevention by screening and predicting imaging biomarkers, as I just mentioned, like mammography for the breast cancer screenings, and again preventing the disease, reassurance by confirmation of the absence of disease, and eliminating needs for further investigations. One classical example I can share from my domain of expertise in parasitic disease. When we think of neurocysticercosis, infections caused by cysticercocellulogy, the larva of Taenia solium, the most important diagnostic approach is by imaging, CT scan or MRI. The advent of CT and MRI has really revolutionized the concept of diagnosis in many infectious diseases, including the parasitic disease. There are hundreds of such examples in each and every domain of medical science. And this contributes immensely for diagnosis, this helping the staging of the disease, like also neurocysticercosis, which facilitate decision about appropriate management. And this has contributed immensely for image-guided lesions, biopsy, for histopathology, making more useful in better diagnosis of the clinical picture. This contributes immensely to the clinical decision support, facilitating the choice of the most helpful and most targeted investigation to answer a clinical questions. And imaging services has an important role in delivery and monitoring of therapy. Interventional radiology, minimally invasive investigations and treatment that has contributed often in a speedy recovery of the patients. And definitely the prognosis has been of the infection of the disease has been greatly improved in recent times with the available of a variety of various imaging modalities. And the most widely used system, picture archiving and communication system, PACS, is extensively used in any tertiary, any standard hospital, which is playing an important role in medical imaging services because by PAC, it is readily available and accessible to the physicians and clinicians that can manage reports in a better way. We do have such system in our universities too. And we at SBV has been focusing on the strengthening of this imaging services at SBV by initiation of various modalities, starting from computer radiography, ultrasound, MRI, recently introduced MRI 1.5 Tesla with perfusion imaging, and cath lab. And sound machines of our most recent and state-of-the-art G120 slice, CT scanners, and other interventional procedures that has been carried out at SBV, like UCG guided FNAC to even percutaneous transhepatic biliary drainage and so on. We have been focusing the use of these imaging services, not only clinical care, but also in the research and evaluations in delivery and monitoring of the treatment. So Now, I just like to share some of my thoughts, how to strengthen the imaging services at a university or health science institutes of excellence or tertiary care. There are many approaches which are being followed, but just I can summarize few, that the imaging services can be strengthened through many approaches, few of them being installation of various medical imaging modalities that contributes to the clinical care as well as the management of the cases. And second, another approach to strengthening the imaging services is to make it easily accessible. These imaging services, imaging reports to be easily accessible. And definitely in this context, we must understand, we must remember World Health Organization initiatives, how to strengthen the imaging services in reference to particular safety and biohazard, minimize biohazards. And again, as I mentioned you, in this 21st century, when we talk of industrial evolution 4.0, and we are talking about Internet of Things, big data management, robotics, and artificial intelligence. And this artificial intelligence is projected and will contribute immensely for the improved or strengthening of imaging services for better diagnosis and patient care. When we talk about various medical imaging modalities starting at universities, the healthcare should use various modalities. And the biggest advantage is that since every modality, for even X-ray or ultrasound or CT or MRI, have their own limitations, but definitely we can get a comprehensive picture when we take all these modalities together. Hence, it's always useful to correlate with other imaging studies. So it is always essential that a health science university should have the facilities for variety of imaging services and for better improvement and for the treatment. And the most important thing is not only introducing various imaging modalities, but another approach is to evaluate and implement that all these imaging services are easily accessible to all the stakeholders, in particular the clinicians. Hence, because accessible to images, when it will be readily available, this will help in faster and better diagnostic approach to the clinical picture, resulting in reduced time consumption by the clinicians and physicians. And this contributes to the work of patients. And obviously, the PAC is playing an important role in making easily accessible the imaging services to all the stakeholders, including clinicians and patients. Now, when you think of World Health Organization initiative for strengthening of imaging service, that is mostly focused on to reduce harms, potential risk of patient from the radiation technologies and maximize the benefits. Global initiative on radiation safety in healthcare setting of WHO mobilize the health system in particular towards the most safe and effective use of radiations in medicines. This initiative provides a platform for collaborations between multiple stakeholder sectors and stakeholders to improve the implementation of radiation safety in healthcare setting, which has become an important role in strengthening of the imaging services. Last but not the least is the artificial intelligence. Artificial intelligence is a science of 21st century. This is being affecting all the spheres of our life, in our social life, in our personal life. And also, this will contribute immensely for the qualitative improved life of the healthcare systems. There's a great optimism that artificial intelligence can provide substantial improvement in all areas of healthcare, from diagnostic to treatment. It is strongly believed that AI tools will facilitate and enhance human work, but never substitute, but supplement the activities of healthcare. When we think of artificial intelligence, I can just give you one or two examples which have been extensively evaluated, tried. For examples, in diagnosis, artificial intelligence for better algorithms, AI algorithms in pulmonary tuberculosis being extensively evaluated and tried by analyzing the X-ray images of the chest and to find out algorithms that will make the help contribute for the improved diagnosis or management of the cases of the pulmonary tuberculosis. In a similar way, diagnosis of neuropsychosis. Many studies are going on. They evaluate CT and MRI pictures of the neuropsychosis and trying to find out algorithms that will contribute for the early diagnosis or better diagnosis that will have a quicker and earlier management. So there are many examples in both infectious disease and non-infectious disease in which artificial intelligence is being projected to play an important role. This general artificial intelligence is ready to support healthcare personnels with a variety of tasks, starting from administrative workflow, clinical documentations, patient outreach, image analysis, medical device automations, and patient monitoring. This is never-ending list. So this is a field in which when we can have a synergy with artificial intelligence and this newer varieties or older varieties of imaging modalities, that will give rise to better diagnosis for it to use on a larger scale. In essence, this 21st century holds a lot of promise with respect to newer methods of imaging and integrating them with newer technologies such as artificial intelligence. And as we move forward on that aspects, definitely looking forward the ways and means to minimize the hazards of radiations, but again augment the maximum benefits with imaging. That are the strategies of the future, and that will contribute immensely for the improved diagnosis, better prognosis, and it will have a lot of epidemiological contributions in the field. Thank you. Thank you very much for your patience hearing.
Thank you so much, sir, for the brief about the role of radiology and the upcoming artificial intelligence. Now we have another eminent speaker, Vice Chancellor of Dr. Mahapatra. He's completed his MBBS in 1975 from MKCG Medical College and is one of the MCH neurosurgeon from AIMS. He also has the interest area of including pediatric neurosurgery, head injury, and skull-base injury. He's carried out 30 research projects in the last 40 years and authored nearly 900 papers were published, chapters and books. Formerly, he had been various posts like Head of Neuroscience in AIMS, Delhi, and SGPGI, Lucknow. And also our professor interest include pediatric neurosurgery, head surgery, and skull-base surgery. He also won several awards, including Gold Medal in Pharmacology and Dr. G.O.V. Desa Gold Medal for research in neuro-otology. And also they were awarded the prestigious award of Dr. B.C. Roy National Award for 2007 in the category of Eminent Medical Teacher. And over to you, sir.
Thank you very much. Good afternoon. Professor Parija. It was a very interesting lecture by Professor Parija. He has done very well. And all the friends and the participant of this webinar. I think it is a very, very unique program set by your university. I thank your Vice Chancellor all because of his. I think it is educated very well. today's topic is imaging in medical science, innovation and limitations. I think it's a very vast subject. As Professor Parija was telling, if you look at when we are MBBS student at Berhampur, I don't think there is anything except a chest X-ray and abdomen X-ray. When there is a gastric perforation, we want to make somebody stand or in lateral position and get an X-ray to see whether the air on the diaphragm or not. For hemothorax, we do chest X-ray and fracture plane X-ray. For head injury, I remember in my surgical unit, anybody came with head injury, say just wait for the death summary to fill up, nothing can be done. From that time, in early 70s, when I went to AIMS, I saw different radiology like angiogram, radiology like pneumoencephalogram, ventriculogram, myelogram, because then I saw IVP, intravenous cholangiography, oral cholecystography, and many other things like barium swallow, barium through, barium follow through. I saw endoscopy in gastrointestinal OPD and also bronchoscopy. So it was a wide experience for me from a medical college in Odisha to AIMS Delhi. And when we went to neurosurgery, there are books on neuroradiology. And also when I went to urology, there are urological radiology, and GI surgery, there was gastrointestinal radiology. For the colorectal surgery by Golliger, there are radiology of the colorectal diagnosis. So wherever I was going, urology, pediatric surgery, neurosurgery, they are all specialized X-ray, few of them being practiced at AIMS. So if you look at those days, there was no CT scan, there was no ultrasound, there was no MRI, PET, SPECT, image fusion, nothing was there. But we had all other things. I still remember puncturing the carotid artery through palpating the carotid artery through a needle and doing carotid angiogram through the direct neck puncture. So here I have shown the modern technology of a craniophagus baby in the side, where when we do the 3D printing of the brain arteries, you can see that how the brain arteries are being looking at, and so the brain arteries and image fusion and angiography showing the common vessels. So here I have shown just side by side how the modern technique has improved over last 125 years or so. So it is very interesting because today all in diagnosis, management and many therapeutic procedures are done under either the fluoroscopic control, image guidance control, or ultrasound guided control, intraoperative MRI, intraoperative CT, intraoperative DSA. So if you are doing vascular surgery, you can see the clipping is perfect or not. If you are doing tumor surgery, you can see the intraoperative MRI, which all of them we had at AIMS Delhi. So we know that there is tremendous development of radiological science, but for nothing but quite a heavy cost. So you have to know the limitation, what you want and what you don't want. As Professor Parija was talking, it was a tremendous innovation in medical science to have X-ray. And he was giving how the X-ray were developed by Ronald Röntgen in Würzburg University as a professor of physics. Those days, in past 5 years or so, there are chest X-ray, X-ray of the limb, X-ray of the abdomen. So things have become so important for everybody to understand. X-ray is a very important part of the diagnosis and follow up to see what are the result of the treatment. So it is very important to understand from there in late 19th century to early 20th century, when we had got fluoroscopy screening and digital radiography and tomography, it was a great development. Here I have shown a picture and a 3D printing of a craniophagus baby where the sagittal sinus was common. And it was all possible because of image fusion and software package what Dr. Parija was telling about the artificial intelligence use. In 2004, I was in Buenos Aires for a half-day conference on craniophagus, and there are, by that time, only 4 or 5 babies were operated. and they were showing the software package for about 3 or 4 lakhs of rupees, which can give you the image fusion. So from that, we have now come to many more new technique, innovation, advancement, so that we have got intraoperative MRI. Here I have shown the bottom pictures, the image fusion, CT and MRI fused, and image guidance at the operation theater. This image guidance is a system where you can image the brain in the real time by sensitizing instrument, so that wherever you put, you see that what distance the brain is from that point. So you can do, instead of doing stereotactic surgery, you can do image guidance surgery in the brain by sensitizing your instrument, which can be seen in relation to the CT scan in the brain. So these are very, very important. Here I should tell one person, whatever you do, we do not do any radiological procedure in below 3 years of age, because that gives a lot of radiation. So today, there is, even after so much of innovation and development, we need chest X-ray, we need X-ray for fracture because of medical point of view, we need chest X-ray morning, evening in ICU to see the progress of pneumonia. We require portable X-ray for many purpose, ICU, operation theater, and many places. So despite of so many advancement in radiological imaging, there are several need for the plain X-rays. So we now have, these techniques are more important to understand, non-invasive and painless. They can diagnose disease, they monitor the outcome of therapeutic procedure, can be used in sports medicine, and support surgical treatment. Many things are common, most commonly used for diagnose injury bone, dental chest X-ray, mammography, arthritis. So all development as one side, but role of the plain X-ray can never be overemphasized, because we still need plain X-ray for many purposes. So now comes digital radiography. When the digital radiography came about 30 years back or so, we did not have to use cassette. It captured and transferred data to computer, from where the data is processed and transferred to a printer where the printing is done. So we don't have cassette. You don't require a dark room for development. So this was a great innovation in field of imaging, radiological imaging, that we have DR. But it costs a lot of money. This DR costs between 35 to 40 lakhs. And one has to judiciously use, because the process is easy, the cost is much more. So that is one have to understand. So we have got versatility of this one. It's very versatile, and overall image quality is very good. When digital X-ray came, we got the quality X-ray, so that everybody said we want digital X-ray. So it has accuracy and quality control, and versatility is very high. So that was very much important. We have fluoroscopy. Fluoroscopy show you the cine picture. If I swallow some barium or something and get a fluoroscopy, I can see the movement. I do a fluoroscopy after taking the barium meal. I can do a cine barium through or follow through, or a cine esophagogram. So there are a lot of advantage of fluoroscopy, but it has a tremendous radiation to the surgeon, to the person doing it, and also patient. So fluoroscopy also has a limited role now, because it is replaced by many more sophisticated investigation. So now we have got interventional guidance. When you have intervention, we use many times fluoroscopy. For example, we are doing a transfemoral surgery. We have to several times do a fluoroscopy. We are doing the placement of screw for a fracture. We have to do fluoroscopy. We are doing a vertebral instrumentation. You have to do fluoroscopy. So even though fluoroscopy gives a lot of radiation, its role has been tremendous in the field of bones surgery, neurosurgery, where you have to see every time something happening in real time. So it is very important innovation, yet it has a lot of side effects and limitations. So I always say that whenever you use fluoroscopy, be judicious, put the TLD badge and see how much radiation are going. Same for the urology. When a urologist does any procedure, they use frequently, they use fluoroscopy. Cardiology, neurology, neurosurgery, all these are doing fluoroscopy with their own risk they have to take. So the question is that all these are necessary for diagnostic. Now they came when I was operated for gallbladder stone in 78, there was no ultrasound. So I had oral cholecystography. They were suspecting kidney stone or gallbladder stone, so they got intravenous pyelography, then the intravenous cholangiography. So for just diagnosing gallstone, which is non-radio opaque, I had OCG, IVC, and IVP. So 3 major procedures which are never seen in Odisha at those days. Then came mammography in late 80s or mid 80s. Mammography is a very important procedure for breast screening. We know that there could be very many benign tumors in the breast which require repeated checkup, and they have to be differentiated from adenoma, breast adenoma to the carcinomas. So mammography is a very important procedure for screening the lady to exclude any breast lump which is malignant or benign. And then came CT scan in mid 70s. The first scan came in 1978 March in Ames, for which people got Hansfield and Godfrey Hansfield and Ambrose got Nobel Prize in 1979. Then came MRI. MRI is a very much innovation in the imaging field, and MRI got ordinary MRI, then MR spectroscopy, functional MRI, MR spectroscopy, DW image, and special images. MRI is a very vast subject. MRI being used in the oceanography and navigation in the sea for a long time. So it is not a very new technique, but it was used first time in 1970s and got Nobel Prize in, I think, 2003 or so. So tomography and mammography developed in late 70s. Tomography used to slice the object many times, and mammography used for the breast lump. So use of radiology is also this technique of tomography used in radiology, in archaeology, in biology, in geographic physics, oceanography. So it's a slicing. How far you are going to ocean, how far you are taking through a depth of the soil and all this. So it is also used for the plasma physics. So tomography is a technique of slicing the object. It could be human body, it could be something else. So it has a vast non-medical application. So tomography could be medical, non-medical field. It has a linear or non-linear. Mastography or mammography, I just talk about that, deal with non-cancerous versus cancerous, but it has a limitation. Mammography has a false positive, false negative up to 15%. So 1 in 8 patients you can still have misdiagnosis, either overdiagnosis or underdiagnosis. But it's a very important screening for diagnosis or exclusion of the breast cancer. So fluoroscopy developed 1886, and if you go through that, different phases, different things developed, and people got Nobel Prize for various. And we now have intraoperative CT, intraoperative ultrasound, intraoperative MRI, and intraoperative image guidance. All these things we use practically in neurosurgery every day. So whoever performs these radiological techniques, he gets radiated himself, and patient also get radiation. So when you use heavy machine in operation theater, you are also have to be careful that you don't get too much of radiation, because it is a neurosurgeon, orthopedic surgeon, radiologist, and cardiologist, those who do stenting, they get a lot of radiation. Here I have shown a vein graft for the sagittal sinus of craniopagus baby. This was the surgery we did 2017. So there is a need for imaging. Always there is a need for imaging. If you look at 1950 and 70s, it was only diagnostic. Then some treatment was started in 70s by using radiological control, by injecting nerves, by injecting tumors, and doing fluoroscopy. So this was the thing. But if you have to see what is the recommendation of MCI, MCI for starting a medical college recommend X-rays, fluoroscopy, barium, OCG, and CT scan is a must for MBBS. But if you are studying postgraduate classes, you should have MRI also mandatory. So in 1970s and 1990s, we have developed ultrasound, CT scan, angiography, and in 90s and 20s, we developed MRI, MR intervention, image guidance, image fusion, role of artificial intelligence, which Dr. Parija was talking. Here I have shown two babies, but the brain was fused, and these pictures are post-separation in ICU. I have just put it. A huge number of neurological technique, radiological technique was used during intervention in operation theater, that is intraoperative MRI, intraoperative image guidance, implanted ultrasound, and image fusion and 3D printing. So all these things are used in our case when we operated these two children fused in the brain. So if you have a medical college, you require 400 500 crores of rupees for a medical college, out of which 40% required for radiology. So it is very important to understand radiology is a very important in medical science. When I was AIMS, we had 6 AIMS started phase 1. So our equipment for each AIMS was 250 to 200 to 250 crores. 40% was radiology, radiotherapy, nuclear medicine. We had CR, DR, mammography, CT scan, 250 slice CT, then 64 slice CT and MRI, 3 Tesla, angiography for cath lab, USG, portable X-ray, linear accelerator, gamma camera, everything, gamma camera and brachytherapy. These are all part of either radiology or radiotherapy or nuclear medicine. This all cost between 250 to 200 to 250 crores. That time, I think it will be around more than 250 crores. The manpower we need, only limitation is that when you have so much sophisticated instrument, we do not have radiologist, we do not have technician, we have no BSc imaging or MLT. So we have got many districts, there are CT scans, but no radiologists or no radiographers. So we need really, our limitation is the creation of manpower, both in the CT scan room, in the operation theater, in the ICU and OTs. So these are the very important thing to understand. Only equipment doesn't matter. You require personnel trained for using them, selecting what is appropriate for an individual and what should be judiciously used without damaging the patient and putting a lot of extra cost. So at AIMS, I was in neurosurgery. In neurosurgery, we have purchased one for gamma knife, one for intraoperative MRI. We had 2 mobile CT, one for trauma center, one main center at AIMS. We have intraoperative DSA, which we purchased from the Siemens. We have intraoperative MRI, which we purchased for the Siemens. At BVSR, we purchased 300 crores, out of which a lot of equipment I have already told. When I was Sanjay Gandhi Medical College, Sanjay Gandhi postgraduate, all the equipments are 20 years old in 1980s and 90s, and I had to replace it between 2006 and 8. So we purchased 2 CT, one 40 slice wide bore CT for radiotherapy, one 64 slice CT for diagnosis, MRI, 3 Tesla, gamma camera, 4 of them, 3 with CT scan, PET CT, and 1 without CT scan, 1 PET scan, and 1 DSA. These are very expensive equipment. However, they are necessary for the day-to-day practice for advanced medical center or medical university. So we have to have imaging at very important diagnosis, but we have to know what is necessary for whom, for therapeutic purpose, diagnostic purpose, follow-up purpose, or research purpose. So it is very, very important to understand we have judiciously used for therapeutic, for diagnostic, and for research. And if you look at the people got Nobel Prize in 1895, Röntgen, in 1979, Hansfield for the CT scan, Richard Hans for MRI, Sir Peter Field for functional MRI, MR spectroscopy by Ogawa from Tokyo. Raimondi, he had done some modification of Ogawa procedure, then Michael Feld 2007. So there are eight Nobel Prizes given in MRI for various innovation and and further research in MRIs. So in conclusion, we know that radiological imaging and imaging in diagnosis, in therapeutic, in following the outcome of the procedures, and also in research is very, very important. We have to judiciously use it because it not only costs a lot of money, it gives a lot of radiation. So there is no point of doing multiple radiological investigation if you can manage by one. So it is the part of the clinician to see that what is the best for an individual. And the role of radiologist is that if a clinician have lot of unnecessary investigations, he can always challenge it. So there is no chance of doing unnecessary investigation. Thank you very much.
Thank you, sir. Thank you so much for the wonderful talk regarding radiology role. So if any questions, you can put in chat box. Due to shortage of time, I think you can mail also if any queries is there. So the next web series meeting, SBV CONNEcT meeting on May 18th. Thank you, Parija sir, and thank you, Mahapatra sir, for the wonderful talk. Thank you once again.